Finals SAQ 89 Child Abuse. You have anesthetized a 5-year-old boy for manipulation of a forearm fracture. During the operation, you notice that he has multiple bruises on his upper arms and body that you think may indicate child abuse. A. Which other types of physical injury should raise concerns of abuse in a child of this age? This includes unusual or excessive bruising, cigarette burns, other thermal injury, bite marks, injuries in inaccessible places such as neck, ear, feet and buttocks, unexplained intraoral injury, anogenital trauma or unusual anogenital appearance, trauma without adequate history, delayed presentation, inconsistent explanations. B. What timely actions must be taken as a result of your concerns? Act in the best interest of the child. Respect child's right to confidentiality, although this is not always possible in cases concerning actual or possible abuse. Check hospital notes for known safeguarding issues, details regarding other members of family. Inform anesthetic consultant on call, child's pediatrician, on-call pediatric consultant if out of hours, safeguarding team within hours, theatre team which includes surgeon, senior scrub and ODP. Ask the pediatrician to look at injuries as long as this does not excessively prolong anesthesia. Brief visual assessment only. Full documentation of findings and actions. Consultant pediatrician and anaesthetist to discuss the issue with parents and child after surgery, except in unusual circumstances where this may increase risk to the child. If there is a fully reasonable explanation, then no further action is taken. If there is continued concern, consultant pediatrician should refer social care, possibly involve police if there is risk to other children at home. Take full history from the child and carer, and consider need for forensic examination, and decide whether it is appropriate for the child to go home. C. List parental factors and features of child's past medical history that are known to increase risk of child abuse. Parent-related factors include step-parents, teenage parents, substance abuse, parent abuse as a child, disabled parent, mental health problems, single parent, domestic violence, social isolation, unemployment, poverty, difficulty bonding with newborn, lack of awareness of child development or having unrealistic expectations, and parent being involved in criminal activity. Child-related risk factors includes chronic physical or mental disability or illness, prematurity or low birth weight, unplanned or unwanted child, failing to fulfill the expectations of parents, under 4 years old or an adolescent, identifying as being lesbian, gay, bisexual or transgender. Comments: 44.7% pass rate. This is an important topic which is relevant to the practice of pediatric anesthesia and forms part of mandatory training for all doctors. Many candidates appeared not to have knowledge of presenting signs and symptoms of child abuse. Candidates assumed that the parents were harming their child, so missed important steps such as informing senior pediatrician before contacting social services. Further information regarding child protection and safeguarding. Child abuse is classically defined as acts of commission or omission, which results in harm to a child or young person. Prevalence is as high as 6 in 10 children under age of 5 years old in international studies. Different forms of abuse includes physical abuse, emotional or psychological abuse, sexual abuse, neglect, exploitation, fabricated illnesses, institutional abuse, bullying or peer abuse. In physical abuse, there is intentional infliction of physical harm or injury to a child. Indicators include unexplained bruises, cuts, burns, bite marks, abdominal trauma, head trauma, or slap marks, frequent injuries with inconsistent explanations, fear of physical contact or flinching, and poisoning. Emotional or psychological abuse, behaviors that harm a child's emotional well-being or self-worth. Indicators include low self-esteem, withdrawal, anxiety, or depression, and extreme behavior, such as overly aggressive or passive, drug taking, and self-harm. In sexual abuse, the child is involved in sexual activities, including exploitation. Indicators include inappropriate knowledge of sexual behavior for their age, pain, bruising, or bleeding in genital areas, sudden changes in behavior, or avoidance of certain individuals, inappropriate behavior, STIs, and pregnancy. Neglect is failure to provide basic physical, emotional, educational, or medical needs. Indicators include persistent hunger, poor hygiene or inadequate clothing, frequent absenteeism from school, untreated medical conditions, developmental delays or failure to thrive. In exploitation, the child is used for personal gain or advantage. Indicators include fatigue or injuries from overwork, limited freedom or excessive secrecy about their activities, fearful of authoritative figures. In fabricated illnesses, there is inconsistent or unexplained symptoms and signs, poor response to treatment, unexplained prolonged illness, and erroneous or misleading information. In institutional abuse, abuse occurs in settings such as schools, care homes, or detention centers. Indicators include complaints or reports of mistreatment, and multiple children exhibiting similar patterns of fear or distress. Bullying or peer abuse. There is harm caused by other children. Indicators include reluctance to attend school or social activities, sudden behavioral changes or withdrawal. It is important to understand at the outset that in some instances of abuse, it may be difficult to determine as to whether there is a deliberate intention to harm. For example, in cases of extreme poverty and/or when caregiver has learning difficulties or extensive health and/or social care needs themselves. However, this does not make the abuse any less real or mean that it should be acted upon less urgently. Child protection is the process of protecting children and young people who are either suffering or may be suffering the effects of abuse and/or neglect. Safeguarding is a broader term which also encompasses the promotion of the welfare of children and young people, which includes prevention of maltreatment and ensuring that children and young people are brought up in a safe environment. Duties of the anaesthetist. This includes to act in the best interests of the child, be aware of the child's rights to be protected, to respect the rights of the child to confidentiality, to contact a pediatrician with experience of child protection for advice, where appropriate, to report child protection or safeguarding concerns to relevant professionals, including social care, to be aware of local child protection mechanisms, to clearly document findings in association with pediatric colleagues, to be aware of rights of those with parental responsibility. Care pathway for anaesthetists to report safeguarding and child protection concerns. Anaesthetist has concern about child's welfare. First, inform surgical team, discuss with on-call consultant pediatrician, named or designated doctor or nurse for safeguarding and child protection as appropriate. If no further safeguarding or child protection action is needed, ensure documentation is complete. Consultant pediatrician and anaesthetist should have a discussion with the parent and the child when the surgery is complete. If concerns remain, ensure documentation is complete. After assessment is made, safeguarding and child protection procedures should follow. The vast majority of anaesthetists, along with other doctors, will need to maintain Level 2 competencies. Regarding Level 1 training, this should enable providers to recognize possible indicators of child maltreatment and know who to contact if they have concerns. Level 1 training is for clerical or admin staff with patient contact. Level 2 training should enable providers to use their professional and clinical judgment to understand what constitutes child maltreatment, to identify possible signs of child abuse or neglect, and know the appropriate referral pathways to report safeguarding issues. Level 2 training is for all clinical staff who have contact with children. Level 3 training is for clinical staff who have extensive and regular contact with children, young people, and/or their parents or carers, and have a role which enables them to assist in assessing, planning, and evaluating the needs of a child or young person when safeguarding issues arises. Prevention of child abuse. This requires a multi-sectoral approach. Effective and promising interventions includes parent and caregiver support, education and life skills approaches, norms and values approaches, implementation and enforcement of laws, and response and support services. WHO 4-step public health approach includes defining the problem, identifying causes and risk factors, designing and testing interventions aimed at minimizing the risk factors, and disseminating information about the effectiveness of interventions and increasing the scale of proven effective interventions. These are my references. Thank you.